Please welcome the Honorable Lourdes A. Leon Guerrero, Governor of Guam, Megahagan Guahan, as well as Lester Carlson, Director of the Bureau of Budget and Management Research, and Dr. Ricky Hernandez, Deputy Administrator for the Guam Economic Development Authority. And now to Governor Leon Guerrero for her opening remarks.
Thank you, Janella. Half a day. While we remain in pandemic condition of readiness, one, I want to report that we are maintaining our progress in achieving a transition to pandemic condition of readiness two. With that, guidance is expected to be released in the coming days regarding which businesses can begin to responsibly reopen on a limited basis toward regaining some sense of normalcy. Though we are glad this progress has been made, no one can ignore the immense pain this disaster has caused our working family. As Daphne indicated to you earlier this morning, Guam received approval of our Economic Impact Payment Implementation Plan. Though we have not received cash from the U.S. Department of Treasury, Daphne has assured me that we have the tools and the processes in place to act quickly after the funds arrive. That said, I know that many of our people need immediate relief. For that reason, Executive Order 2020-12 establishes Programan Salapi Azudon Itauto, a direct disaster aid program that will be paid for with the coronavirus relief funds authorized under the CARES Act. Under this program, individuals applying, depending on their household size, making equal to or below 165% of the federal poverty level, are 18 years or older and have been residents of Guam for at least 6 months, will be paid $300 per eligible person, not to exceed $1,200 per household. As an example, for a household of one, 165% of the federal poverty level is $1,718 a month. This adjusts with every additional individual, adult or child in the household. This means for a household of 4 and above, they will receive up to $1,200. Using existing data from public health, this would immediately cover more than 18,000 households, representing 55,000 people. I am ordering that the first checks be cut on Friday, May 8th. For those that may be eligible and have not received a payment, they may apply with the Department of Public Health. The application can be found on Public Health's website, and applications can be dropped off at Public Health Castle Mall, Suite 16 in Manila. Applications can be mailed to public assistance at dphss.guam.gov. People can apply until next week, Friday, May 15. Additionally, Executive Order 2020-13 that would take 4 immediate steps in increasing our administrative transparency with the use of federal funds relative to COVID-19. First, as a businesswoman and governor, I have always valued independent third-party review of programs and their related expenses. For this reason, as always, we will fully comply with any audit requirements given to us by the Office of Public Accountability, and I have ordered the procurement of an independent third-party reviewer for federal funds used during this response effort. This means that in addition to local audits conducted by the OPA and audits conducted by the federal government, we will also submit ourselves to concurrent review by an independent third party. I also want to note that I have transmitted a budget for the use of COVID-19 funds under the CARES Act to the Speaker of the Legislature and the Chairman on Appropriations. Adding to our increased transparency efforts, effectively, immediately, responses provided by any executive branch line agency to request for documents related to this emergency will be submitted to the Attorney General's office to post on its website. This submission will be made no more than 2 days from the date of the response to the Sunshine Act request. All line agencies will compile responses provided relative to this disaster since the declaration of the public health emergency on March 14th and submit them to the Attorney General's office. This will allow every citizen the opportunity to regularly review documents secured under FOIA and our responses to them. Through Executive Order 2020-13, I will also establish the COVID-19 Pandemic Recovery Office to act as a single repository of information related to COVID-19 response and recovery. I ask for you to close businesses, cancel social gathering of any kind, and stay at home, all in an effort to keep our friends, our families, and our community alive. Despite the uncertainty, our island acted collectively, not because of any order, but because we care deeply for each other. I will be forever grateful for your courage and patience during these unprecedented times.
All right, thank you, Governor. Now we're going to open up the floor to questions. Just to remind everybody, the governor will take any and all questions. Each representative will be given an opportunity to ask one question and one follow-up for multiple rounds. And as a courtesy to each reporter, we ask that you regulate your individual mics and give others that courtesy during their turn. We'll begin with I-94, Adriana Cotero.
Hi, everyone. How's everyone doing?
Good, thank you, Adriana.
Okay, so for my first question, we recently had Lieutenant Governor Josh Tenorio, and he had on our Containing COVID morning segment, and he told KUAM News that the emergency procurement of hotels for the government of Guam quarantine and isolation facilities does raise some red flags. He also said that based on his experience, the way the legal counsel has handled this emergency procurement and is in a way that emergency procurement is not supposed to be handled. The Lieutenant Governor also raised issues with the fact that the Public Health Director, Linda DeNorcy's digital signature was being used on quarantine procurement documents without her approval or knowledge. And in addition, Legislative Procurement Oversight Chair Senator Sabina Perez told KUAM News that DeNorcy's signature being used without her approval was, quote, fraud. With all this being said, do you still stand by your legal counsel's handling of this procurement, and do you believe it will stand up to federal scrutiny for reimbursement?
So I just want to also start off by saying this COVID crisis has been a very unprecedented event. This kind of emergency has never been experienced by anyone here and also by anyone globally or even nationally. We have heard many messages from all over saying that this emergency is really a very serious kind of virus disease. And in saying that, when we got our 3 contact COVID positives, we quickly and expeditiously and aggressively put in measures to try and contain this virus. Why? Because we want to save the lives of our people and we want to contain this virus. So in the issues of procurement, when I declared a public health emergency under the Public Health Act that was passed by the legislature, when I declared that, that gave me some powers to quickly act and to quickly make decisions and to quickly get the resources that I need in order to save the lives of our people. One of that is suspending rules and regulations, which also related and applied to procurement. So when we got these contact people and we were public health wanted to do a quarantine of all people coming in, we went forward and got the facilities. The way that we handled this procurement and the way that we used our emergency powers are within the law as stated. I truly, fully believe that the legal counsel and the legal team acted appropriately. They acted within the bounds of the law, and they acted quickly to help in helping the community contain this virus. So yes, I stand behind my legal counsel's actions.
Okay, and for a follow-up then, so the pandemic response plan assigns GHS and the Office of Civil Defense to handle procurement. So why did you feel it was necessary for your legal counsel to handle negotiations for quarantine isolation facilities? And what else is being negotiated on behalf of the government in response to COVID-19?
So I directed my legal counsel to quickly handle this situation. And yes, once contracts are signed, once agreements are made, they go through FEMA. And when we decided to go out forward, we decided that we wanted to work quickly, like I said, and we worked with GHRA. So FEMA is put in the loop. We give all the information to FEMA. And there were discussions with FEMA about this facility. There were discussions with the Homeland Security. So FEMA was aware of what we were doing.
Can I can continue with more questions? Or are we going to go in rounds?
We're going to go in rounds. Thank you, Adriana. Next is Nick Delgado from The Point. 1 second, let me just. Go ahead, Nick.
Half day, Governor. Half day, everyone. Before I get to my questions, I just want to say, as a professional who helped share the news here at home, thank you to your administration for the apology to what happened at last Thursday's press conference. To the Lieutenant Governor, though you were in the same room where the media was being censored, you apologized 4 days later, and we heard you. To the Governor's Policy Director, Carlo Branch, you called the editors and reporters who were not specifically being censored that day, but the message was received. Now to the questions for the Governor. We hear some tests, specifically the Abbott test kits, have been compromised by a faulty process, including dilution issues. Can you confirm what test kits or machines and how many potential false negatives we recorded?
Yes, so that I think was a report nationwide through, I think, CDC. And what was happening there, Nick, was the volume of the dilution when you put the specimen in the solution was the cause of those false negatives. And they had already sent out and corrected this. And so our test laboratories here, where we were testing them appropriately and within the corrected procedures. So we were not using 3 millimeters, we were using 1 millimeter. And as a result of that, our tests are accurate.
Okay. Can you tell us more about Linda's digital signature being used without her consent on documents pertaining to those government quarantine facilities? Who will be held responsible, if anyone? And who are all of the cabinet and government workers staying at that site, for how long and why, and what costs to taxpayers?
Okay, so I think there's like 3 questions there, Nick, and I just want to make sure I answered them. So if I forget the other 2, just remind me, okay?
Yes, Governor.
All right. So the first question was the digital signature, right?
Yes, ma'am.
The electronic signature. Was that your first question, Nick?
Yes, Governor, about
All right.
Linda's.
So, okay. So We do have a policy about electronic signatures, and that is electronic signatures are not to be used unless it is authorized by the person who holds the signature. And that is our protocol. And I do know that that does work because I have been involved in authorizing electronic signatures. As far as Linda is concerned, um, there was no contract that was ever brought to her attention. There was what was brought to her attention was a letter, and it was not a document presented before her. It was read over the telephone, and her permission was asked. And she gave and authorized her permission to, to that particular letter. Now, she did say to me that she does not remember and she does not recall. And that can be also plausible because as Linda is the director of public health, and there's, you know, many things coming her way, many decisions she has to make, I can agree that she does not recall or does not remember it. What was the second question, Nick?
About who all of the cabinet and government workers were placed or able to stay over at the quarantine facility, and for how long and why, and at what costs.
Okay, so in the quarantine facility, it is a 24/7 operation. And the way the agreements were made is that the hotel staff is not, they're not there to provide the services. And what happened then is we provided our own workers there. And in order for them to be supervised and in order for us to respond to the services that are needed for those individuals who are quarantined, who are scared, who are wanting to go home, um, we decided that someone of authority should be there to monitor and to supervise and to meet the needs of these people. So it was authorized for two individuals to be able to stay overnight and to be able to provide the services to our individuals. Your third question, Nick?
So it was only two,
Yes.
Okay.
because we were hearing that it was more, but okay, I will follow up later. Thanks, Governor.
Thank you, Nick.
So was that it?
What that was
Was
the
it,
end of your
Nick?
question?
Okay.
Thank you, Nick. Next is PDN, Steve Limtiaco.
Yes, hi, Governor.
Hi, Steve.
I know earlier you said that there'd be more guidance in the coming days about business reopenings. Is there
Yes.
anything that can be shared right now about, in general about what's going to happen? Because,
Yeah.
some of these businesses are uncertain and they want to prepare for this, and it's,
Sure. So we have a panel of recovery advisors, and we work very closely with them. And as we have been saying all along, there are criterias and measurements that we are looking at in order to make the decision to open up. So as you are aware, the strategy since April 25th was to go out and expand our testing capabilities. And so far, we have done that. And I am actually very excited that we maintained our low numbers. We even went to clusters, and as a result of that, we were actually getting really good results, Steve. Some days there was no positives, some days there was only one or two, so that's good. And we have always said that we are looking at at 14 days until we then decide to open some of the activities on our island. So what I'm looking at is by May 9th, I think 9th or 10th, we are going to start lifting some of these restrictions. And I'm thinking about lifting restrictions. Ricky and I were just talking about that today, that we would lift restrictions for retails, lift restrictions for real estate people lift restrictions for shopping centers. They can go to the shopping centers, but they cannot congregate in the food court. They can take out food in the food court. Um, I don't remember all the other ones, but what the bottom line is, the basic guide for that, for our people's behavior, is that we need to make sure that social distancing is adhered to, masks are used. These businesses that are going to be opening, they have already sent in their standard operations plan, which addresses occupancy into the retail, addresses making sure that they sanitize, making sure they wear the mask. So the industry themselves submits their own standard operations in terms of trying to adhere to social distancing and making sure that there's minimal contact. And so therefore decrease transmission and decrease exposure to contamination. And that would then go through the public health people. They would look at that, and then they would put it in their website as the public health guidelines for the particular business. So in terms of time frames, I am looking by May 9th. I think May 9th is the 14th day. Do you want to add
And,
anything?
yeah,
Yeah, Steve, may I add, as it relates to, I know there's a lot of questions regarding when and where these industry representatives can submit these standard operating procedures that the governor mentioned, or adjusted operations guidance or guidelines. And public health, in working with public health and the recovery panel of advisors, what we're doing is we're expecting to release a public health advisory very similar to 2020-05 that had all of the specific essential businesses, essential activities, essential essential other, I guess, construction services and things like that we'll be updating to include those specific businesses that will initially be authorized as being able to open. I think in terms of our recovery plan, there's obviously the how, and public health in coordination with the recovery panel of advisors will be issuing some very minimum pandemic workplace readiness guidelines that should be out, such that these guidelines that are submitted by industries will at least have some minimum guidelines that they're following in terms of social distancing, cleaning, preparing the workplace, training employees, communicating to employees and customers and things like that. So that's expected to be released. In terms of submitting and where to submit these guidelines, just to reiterate what we've mentioned in the last week Thursday, is that the Chamber of Commerce and the Women's Chamber of Commerce has been working very closely with the business community, with their members and other individuals and other businesses that may not be members, to be submitting these guidelines by industry. So the expectation is not submitting guidelines by business, but it's by industry. And once we release the advisory from public health, then we will know which industries will be authorized and therefore need to submit these guidelines. So.
okay. And as a follow-up, it sounds like, so retail is going to be okay. What about services like hair salons or even just eating in a restaurant? Is that still going to be prohibited come May 9th, as far as you know?
Okay, so yeah, services like hair salons, nail salons are going to be allowed to open, but again, with limited occupancy. And their guidelines are that they can't wait in the waiting area. They have to wait outside their car. They can only do it by reservations, by appointments. So again, that's to minimize the congregate issue. And that's the other industry that we're looking at. I also wanted to let you know that but we are looking at doing social gatherings and family gatherings and faith-based gathering of no more than 10 people.
Thank you. Thank you, Steve. The next is Mariana's Business Journal, Wayne Chargaloff.
Could I just make a correction here? We're looking to lift these restrictions on May 11th.
Thank you, Governor. Wayne Chargaloff from Mariana's Business Journal.
Hello, everyone. Hello, Governor.
Hi, Wayne.
Hello. According to the CARES Act budget that was released, it shows more than $313,000 will be devoted to testing. Would that be enough to purchase test kits and supplies to test the entire island, and with those funds?
Those funds are budgeted. Yes, it probably is not going to be enough for all the other for the whole island, and we are going to test as much as we can. But also, CDC provides some of the testings. FEMA will also provide some of the testing. So there are other sources of funds that will provide for testing. So the 383,000 is what we are going to be using from the CARES Act, but there are also other sources of funding that is being used to provide the test kits. And I know Public Health has its own grants also, and FEMA has their own capacity to provide the funds. And also CDC, World Health Organization, we're getting test kits from them, and also from HHS. Do you want to add anything to that, Lester?
Thank you, Governor. The use deadlines for this fund source is December of this year. This is a buffer to be able to ensure that we have resources to be able to continue to test, as the governor has mentioned many times. This is going to be a marathon and not a sprint. So we just thought it would be incumbent to be able to have funding for COVID testing as part of the budget that she put together, utilizing the Coronavirus Relief Fund money.
Okay, and with the addition of those CARES Act funds, how does that affect the projected timeline for testing, and does that affect the model and timelines as far as testing, the pandemic conditions of readiness and that kind of thing? Like, does it speed up the timeline at all?
Not at all. I mean, the testing protocols are pretty standardized. So the swabbing, the testing, the result, and then the verification, the notification, that process needs to be standardized and kept the way it is for accuracy, adherence to science, and CDC guidelines.
What it does do is it provides us the ability to get more test kits, and therefore we can test more people. But as far as the protocol, as far as the procedures and the processes, it's the same throughout. It will also be able to give us more abilities to get people who are out there the test kits, so that like I said, so we can test more quicker maybe and faster.
Okay,
Thank you.
thank you.
Thank you, Wayne. Next is PNC, Kevin Kerrigan.
Good afternoon, everyone. Governor, I wanted to ask you a question about the spending plan you submitted this morning. Just how much of this 117.9 million has already been committed? And is this set in stone, or are you open to any change that might be suggested by the legislature?
So according to Ed from DOA, I think we've only spent a few $100,000 from the 117 million. And that's because we were also waiting for guidelines and advisories to be able to be guided on the ability or the allowable expenditures that we can use. And your second, what was your second concern there, Kevin?
Kevin, are you there?
Yeah, I was muted, so I'm
Oh,
back now.
all right.
Yeah.
So the other one was,
No,
is this
You
budget
have a
set in
suggestion for
stone
change?
and is it subject to, can we make changes? Yes, we're very flexible about this. If there is something that is maybe a much more compelling need that we did not think about, and then it had evolved, we can certainly redo some of the allocations of these funds to provide for that need.
And I'd like to ask another question of Lester, if I could. Looking through some of the appropriations here, they don't all appear to be related to coronavirus. For example, it calls for 2.1 million for the Department of Corrections for things like paint, plumbing, AC supplies under the heading maintaining state prisons and county jails. How did you shoehorn that in?
Kevin, every day my shoes go on very well. No horn necessary. But I'd like to just walk you guys through what my staff and the fiscal team helped to do to get to this point. We spent a lot of time getting agency input, guided by the Treasury guidance that we got dated April 22nd. The layout of the budget is consistent with the guidelines, so it's easier for anybody to follow sequentially items 1 through 6. Now, DOC provided a very detailed breakdown initially of about $90,000 of expenditures to be able to create a COVID-specific area, rehabilitate the area, so that there would be some further isolation within the walls of DOC. Late yesterday, they came back with a more detailed addition that totaled a little bit over $1 million. And I went through that list and I looked at the specificity of it, the applicability of it, and I advised the governor that not only was it extremely appropriate and timely, but well done. So I had no hesitation whatsoever in being able to take the amounts, both expended to date and necessary for future, social distancing, as well as some additional money for telecommunications, with the hope that we can minimize prisoner transfers for hearings, and we can conduct these types of activities electronically.
thank you, Kevin. Next is K57, Patty Arroyo.
Just to be clear, Ricky, Dr. Hernandez, the easing of the restrictions, does that on May 11th, does that actually bring us to PCOR 2? And does public health and the Department of Revenue and Taxation have the resources to ensure compliance?
Yeah, so the movement to PCOR 2 is going to require an executive order to lift some of the existing restrictions that was extended when the governor extended the public health emergency. PCOR 2, again, is very flexible, right? Certain government agencies may or may not open depending on their ability and their preparedness to be open. So there may be phases of opening in PCOR 2 for certain government agencies. Depending on their preparedness. As it relates to businesses, the expectation is that on that date, when PCOR 2 is declared, depending on the triggers that will have to obviously occur, and then that would inform the governor's decision on that. There would be an initial list of those types of businesses that will be added to those already essential activities that are authorized. And from there, that's not a closed list, right? Obviously, during PCOR 2, which is a minimum of 28 days until we could even think about PCOR 3, there could be existing businesses that are not part of the authorized list initially that could be part of it. And so I think in terms of which businesses and the questions that are related to what types of activities, that should be coming out in the next day or two.
So, Patty, is your question also related to your question related to is public health ready for it. I'm thinking you're asking about, can they do the testing? Can they do the monitoring? Can they make sure that the businesses are adhering to what they need to do to continue on with social distancing? So public health is prepared for increased testing, and they are also prepared for increased contact tracing. These are the two criterias that we will be really looking at to see how people's behaviors are in terms of adhering to the measures and the activities that we want them to do to continue containing and maintaining the COVID-19 decrease in positive cases. We're also going to be, of course, using other areas in public health to monitor. And also Department of Revenue and Tax will also be helping in terms of, in terms of going around and adhering to some of the measures that we will be putting in to provide for that protection. So we have discussed this with public health, and we are prepared to provide the necessary personnel.
Thank you, Governor. And so my second question is on this Executive Order 2020-12, which provides direct assistance through public health. Is this money actually fronting for the stimulus funds that should be coming down in the next several weeks for this particular group of people that fall within 165% of the poverty level?
So Patty, no, it does not. It's not fronting for the stimulus checks that we will actually be getting maybe by the second week, by within the period of 2 weeks. But what this is doing is this is a local program that I have created to provide for our people who are out there struggling to make ends meet, who have made sacrifices to help us with the containment of the coronavirus 19. And this is to help them with their livelihood, in addition to the other federal programs that will be coming. So this is actually targeting 55,000 people. This is something that we have established through public health and under the general assistance program. And we heard, and we are very sensitive, and we empathize what people are feeling out there, how people are out there, and again, their struggles to make ends meet, their fears about when are they going to get their income, how are they going to pay their rent, how are they going to put food on the table. It's really a tragic kind of event to go through. And so as a result of this, to make it a little bit at ease, I created this Programan Salapi Adzudanitauto for our people to get over that. And then as soon as the stimulus checks come in, that would also help them. And then as soon as the pandemic unemployment benefit program continues, is established and is started. And additionally, I'm just also very glad to hear that the PPP program that we have out there has given a lot of financial aid to the businesses, which would then help continue on employing our people. So that's another means of income for our people. And I just have to say the PPP program, Patty, is very generous. This is a complete grant. If you use 75% of the loan for your payroll, and again, it's to incentivize our businesses, even if they are closed, to continue to hire and continue employing their employees so that they'll still get an income. And once that happens, then after the period of this program, the grant will be given to them. So for example, if a business borrowed 100,000, conceivably that 100,000 will be forgiven. They don't have to pay for it.
Right.
So there's a
Um,
lot of really good, generous programs that the federal government has given out to us, the territories. And I'll tell you, they have not forgotten the territories. In all of my conferences with the president and the vice president and all the heads of the cabinet, they include the territories. And I think Ricky wants to add.
Yeah, just to add to the PPP numbers, there's about over 1,500 businesses that have been authorized, approved, and or have received their money, totaling 185 million. So, like as the governor mentioned, that's 75% of that is, if they want it to be forgiven, has to be toward payroll costs. So that's 138 million that has to be put toward payroll costs, whereas the other part, the other 25% is for rent, utilities, and interest on debt obligations.
And that roughly equates to be about 17,000 employees. I think we sort of
Right.
estimate it.
Okay, thank you, Governor. I see that Janella has not yet muted me after my second question, but I'm going to be an honest person and allow my time to be given up since I've already asked to, out of all fairness to the other media.
Thank you. Appreciate that, Patty. Next is KOAM, Nestor Lecanto.
Thank you. Good afternoon, Governor, Lester, and Ricky.
Good afternoon, Nestor.
Yeah, I wanted to get back to the program in Salapi. So this is will be through the Department of Public Health, correct? And so people do not have to do anything to get their money?
So we do have data. We're using the SNAP program data, and I think we're using MIP and Medicaid program data. And so right off the bat, we already have that information, and we're looking to start sending out the checks on Friday. We're looking, like I said, about 55,000 people, but we're also telling people to apply, and they can go online and download or print out the application, fill out the application, and they can drop it off at Public Health. There's a drop box. So we are asking people to apply if they're not on the SNAP program and if they're not on Medicaid or MIP, and if they qualify within with that 165% poverty level.
What's that salary level? What's that number?
That's about, like, for one household, it's about 1,760 a month, and then it goes up to almost 3,000 a month, right, for a household of 15.
Yeah, so the federal poverty level is published by the Department of Public Health and Social Services, and it's dependent on the household size. So as the governor said, the household size of one is a little over $1,700 a month. That's 165% of the federal poverty level. Up to and there's households of up to 14 people, and there's an income threshold for that equates to 165% of the federal poverty level. So it depends on the number in the household that will drive the dollar amount that you may want to know about. But that's already listed on the Department of Public Health and Social Services under all of their public assistance programs.
So Ricky, for an average family of 5, just a combined income level, what's the number?
For a family or a household of 5 is $4,149 a month for a household of 5, and a household could be children, it could be multiple adults. It's just a household of 5, and the application process is very similar, or will be similar, at least currently, as anyone that would be interested in think they're eligible for SNAP. And the other eligibility requirements, I think, is that you have to be 18 years old or older, and you have to be a Guam resident at least 6 months. Yeah, so hope that answers
Okay,
your question.
and how about the people who've already received the 1,200 advanced stimulus? They're also eligible for this, correct?
Yes, it's a different program. So it is conceivable that you have gotten the 1,200 and you will also be able to get this program.
And how much have you set aside, Governor, for this?
I think we set aside 20 million.
Okay, and that was contained in your spending plan, right?
Yes,
And there's another 20 million for businesses?
yes.
And how's that gonna work?
That we're doing that through GITA. And so we've given them $20 million to help out with the small businesses. And Ricky can also give you some information about it.
Yeah, the CARES Act, the coronavirus relief funds, that's the $117.9 million. There's guidelines in there that allows for grants, direct grants to, as it relates to covering costs of business interruption for businesses. And so currently we're putting together some programs to assist different types of businesses, mainly by size. So those guidelines, obviously, the governor was generous enough to be able to put, at least, and Lester and the team was able to put some money aside, 20 million, not only for individual assistance, which the governor is announcing today, but also 20 million for grants to businesses. So 40 million of the 117.8 was dedicated to these two things. And so those announcements for those business grants related to business interruption will be announced at a later time.
Okay, and
Thank you,
I have
Mr.
one more
Reyes.
question. I have one more question for the governor before I pass it on. And I'm going to editorialize a little bit here. Do you feel you waited too long and maybe underestimated the level of financial anxiety that families were feeling and then the resulting anger? Did you
I
think
don't
you waited too
know.
long for this?
I think it has been too long, but it's not because of my control. It is first federal control, and also we did not get this 117 million till about maybe a week ago or 2 weeks ago, and we could not use this money until we got the guidance and the advisory guidance on how we are to spend it. It's money, Nestor, that although it's under my authority, but it's not like I could just use it right away. And so the delay in pushing this money out is because we had to abide by federal guidelines and advice, and we didn't get it till I think about a week ago. And I just, for whatever it's worth, the other states also were just as frustrated and just as upset about the delay in trying to move this forward. So as soon as we got the advice, we started creating this program, and so now we have it out. I am very angry that our people had to wait this long, and I am very upset. And I have said this in the past, and I have done within my legal authority, within the regulations, within what I can humanly possibly do to try and push this out. So good things have happened this week. We've got the notice that our implementation plan for the economic impact recovery has been approved, and we're looking at pushing out that money as soon as we get it. And excuse me, we're probably going to be able to do that within the next 2 weeks. Additionally, we are also excited that our implementation plan for the pandemic unemployment program has been submitted, and they've received it. We also received the federal pandemic unemployment compensation agreement, and we are in discussions with the Department of Labor to get that program going. In the meantime, what we have done here is we have prepared our processes so that once we get the monies and once we get the okays and the approvals, we can push them out as soon as we can. So if if it's anything that I can do, I will certainly do it with the best of my ability. I know people out there have been very upset. They have been very, very scared. It's like they have nowhere to go but to rely and wait for this. And again, the delay is something that I I have not in any way intended to do. It is certainly, like I said, I was very angry, upset, frustrated about the delay.
Thank you, Governor.
Nestor, if I may too, we have this coronavirus relief fund guidance from the Treasury. They also put out a fact sheet, and they've been updating the fact sheet. And it's the governor's request, my responsibility primarily to put together the spending plan and make sure that it's consistent with the guidelines, make sure that the cost allocation, Kevin's question about DOC, I understand paint might not be an immediate COVID related thing, but when you're rehabilitating a facility at DOC to house COVID inmates, you're certainly going to need to ensure that the place is up to par. So I had a painstaking review by my staff with all the agencies asking for input. It took a while. The governor was saying, "Are you done yet? Are you done yet?" She was as anxious as anybody to try to get some spending document together such that she would feel comfortable. And then now we're at a point to where she's ready to pull the trigger and make these funds available as outlined. So it is a matter of accountability, transparency, and it's a budget thing. So I had to take the time that I had to take. I wish I could have done it a little bit sooner, but we wanted to do a good job, and we think we did a pretty good job.
Thank you, Nestor. Next is Guam Daily Post, John O'Connor.
Hello, Governor. Hello, everyone. Can you hear me?
Yes, John.
Okay, thank you. Before I ask my questions, I just wanted to clarify the answers made earlier to Nick's initial questions. Governor, you're maintaining that the use of Linda DeNorcy's signature was legal?
The use is what?
Legal. Legal.
Yes, what about it?
Sorry.
Is it what?
You're maintaining that the use of Linda DeNorcy's signature was legal.
I'm maintaining that it went through our protocol. I'm maintaining that it went through the process that we normally do, and it is acceptable way of doing business.
Okay, thank you. You also mentioned that there were two individuals at the hotels. Can you name who they are and why they were selected?
Sure. One of them is Alice Tyron, and the other one is Rebecca Respicio. These people are my cabinet directors, and they were selected because they're responsible people. They're selected because they're very organized. They were selected because they were very competent, and they were selected because they're very compassionate for our people.
Thank you, John.
Did they did they volunteer for the position or were they selected out of your cabinet?
We put out the call for people to help us, and they did respond.
All right, Governor. Thank you. I'll move on.
Thank you.
Okay, thanks, John.
Pacific Island Times, Marvick Hagaragan.
Hi, Governor.
Hi, Marvick.
Hi. So, last week, Senator James Moylan introduced two bills that would provide direct assistance to microbusinesses and employees who have been affected by the crisis. One bill proposes $20 million economic support program that would give $800 to each employee, and the other bill would provide a grant of between 2,000 and 10,000 to small businesses. Will you be, both bills will use the COVID funds. Will you be supportive of this bill, or do you think this is redundant?
We already have this program in place, and so I think his bill is moot because it's the same program.
Oh,
It's providing assistance to individuals, and it's providing assistance to businesses, to include micro businesses, to include sole proprietors.
okay, thank you. I have a non-COVID related question. The Supreme Court, I'm sorry, I have to just insert this question. The Supreme Court denied Guam's petition to review the Ninth Circuit ruling. Can you please comment on that?
Well, it is a disappointment, but it is what it is, and we would have to. I just read it this morning, and I haven't really had the time to regroup with our legal people. But I am going to be meeting with Melvin Borja, who heads the Commission on Decolonization, and regroup and see what other options we have to move forward on. So we could do legislation, we could amend the legislation, we could do something with the legislation that would address the Ninth Circuit's concerns about the legislation, but we are going to move on with the plebiscite.
Thank you.
Thank you, Marvick. We're going to go into our second round. Back to I-94, Adriana Cotero.
Hi, so I want to go back to a few things Nick addressed in the last round. While yes, the media and people have since received an apology from Lieutenant Governor Josh Tenorio and your policy director, Carlo Branch, and I do appreciate it, but I want to ask you, Governor, did you support the decision to censor the media and the action by your communications director, Janella, to press mute on our questions at last Thursday's press conference? And do you also plan to issue an apology at all for not answering the media, more so the people?
So let me just say, Adriana, that I give great respect for my director of communications and policy for being very forthright in apologizing. I also have great respect for the lieutenant governor and very forthright in apologizing. There was no intention of censorship at all. There was no intention of censorship. The fact that it was muted because I know the guidelines were certain guidelines and it wasn't being followed. And it is what it is, and people have apologized. And so I am going to be together with great respect, honesty, truth. Yes, I apologize for the mistake that happened. People make mistakes, government makes mistakes, but I am not ashamed to say we made a mistake, and so I apologize.
I appreciate that apology, and I also appreciate that you guys opened it to unlimited questions for today, and realizing that we are a voice for the people of Guam, and as public servants, it's our rightful. I do appreciate that. Thank you. So for my follow-up, going back to your other answer, saying that 2 of your cabinet members oversee PACSTAR, the quarantine and isolation facility, but can we get a breakdown of all hotels being used as quarantine and isolation facilities, and who, if so, are any other government staff performing these house parent tasks for each facility? What are their hours of operations? What further details can you give us on the work being done by the government staff? And are we paying for these rooms if they're not occupied? I know in your budget breakdown, it allocates $4 million for quarantine. So has this been paid out yet?
So the other facilities is the Wyndham and the Days Inn. I don't know the people who are there. I don't know their names. I know that they are government employees. I don't know their hours. I don't know their schedule. We can get that and give it to you. So I can't answer that part. And yes, we have been paying. Lester might maybe have more to say to that, but we have set aside the monies to be able to pay for the services.
Yeah. Can you say which hotels have been paid then?
You know, I don't know. I'll have to check with the Department of Administration. They're the ones that do the checks.
Okay.
Thank you, Adriana. The Point, Nick Delgado.
Update again. Can we get a comment on the relapse of our COVID patients? I believe 7 was the number last time. Are we to expect more from those who were reinfected with the virus? And where are we with retracing where they've been? For those 7.
So the 7 that became positive, Nick, when I was talking to the doctors, this has occurred, and what has happened is they say when the virus dies, they still shed their RNA, and so when you retest, they'll pick up the RNA and they'll pick it up as positive. They did also say that most of the literature says that it is not contagious, but we are being very conservative and being very cautious. So we are isolating these individuals again, and we are also doing contact tracing.
Okay, so as a follow-up to that, why were they considered recovered before being required a follow-up test?
Because when they were in isolation and they met the requirements set by CDC guidelines in terms of recovery, they met those guidelines, and then they were certified recovered.
And real quick before I move on to the next reporter, I just want to clarify John's question. The 2 directors staying at the hotel, they of course would be qualified to get the 25% hazardous, correct?
That is correct.
Thank you, Governor.
Thank you, Nick. PDN, Steve Limtiaco.
Yeah, sorry, the computer problems. Thanks, Governor. A follow-up on Programan Salapi. Is that it sounds like a one-time payment. Is that correct?
Which one? The Programan Salapi?
Yeah.
Yes. Yes.
So one-time payment with check starting this Friday. And then for the businesses, so Gita's going to be deciding how that money's distributed. Could you explain that?
Yeah, we're currently, Steve, we're currently developing the program, and obviously that's subject to the governor's approval.
Okay, great. And then, and just a follow up on the safe haven, Governor.
I'm sorry, Steve.
Yeah, for the safe haven.
Yes.
So what exactly was the problem with the Paseo Stadium? Like what were the issues there, and what other sites are you looking at as a result?
Yes. So when I actually was given the progress report, and the bathroom facilities and the shower facilities was not ready, I did not want to bring the homeless there when those facilities aren't ready. Additionally, when public health went to look at it also, and with the guidelines of homeless, what happened was that we were told and advised that the most effective way of dealing with our homeless is to put them in a hardened facility. So that's what we're looking at now. We're looking at other places where we can use structure. And we're in the process of looking at various sites to do it. And so that basically was what was the concern there with the safe haven.
Thank you, Governor.
Thank you, Steve. Thank you, Steve. Mariana's Business Journal, Wayne Chargaloff.
So, hello, can you hear me?
Hi, Wayne.
Hi. Hello. Okay. So, one of our readers has a question. They cited some CDC statistics saying that the national average for positive COVID test rates for clinical labs is 10% and 15% for commercial labs, where Guam's daily positive test rate is less than 3%. So his question essentially amounts to, given those statistics, wouldn't it be, is Guam being too conservative in its approach to reopening? And is it perhaps incurring too much economic damage when its rate of positive COVID cases is so much lower than the national average? So what would you say to that?
What I would say to that is we did a good job. And we did a good job because our rate is only 3%. And we are very fortunate that we did a good job. I would hate to go into the reality of what was being projected with thousands of COVID cases and hundreds of fatalities. And that's why we were very prepared. And for me, I would rather be very prepared, overreactive than sorry. And so we are following guidelines that have been proven to be good guidelines. And we will continue to do that. And we will slowly and methodically reopen till we're assured that we have contained this virus. And I'll tell you, I'm very confident that we will. What does worry me is everyone says there's going to be a second wave. And we are projecting that the second wave isn't going to be till October. And so these next weeks are going to be very telling in how we are going to move forward with the reopening of our island. You don't mess around with this virus. They're even saying that it now does affect children. And they're even saying that when it affects children, children get seriously, severely ill. So I am very aware about our economic health. But we cannot have an economic health if our people are not healthy. We cannot have an economy if we don't have people. And so the focus, yes, is on the health side, but I am also very much concerned about our economic health. That's why every time I push about all of these programs that we are bringing forward, and I've been in close communication with the chambers of commerce, the women's chambers of commerce, the business community, and we are working very closely to see how we can best balance the health of the individual and our economic health.
Thank you.
So
And
it's
for
not
my,
overreacting.
okay, thank you. And for my second question, has there been any talk of prioritizing testing for employees who work for essential businesses, for instance, people work in grocery stores, restaurants, considering that they have so much contact and exposure to the public? And if not, would you consider such a program?
Absolutely. We're trying to make our way to that level. And so we looked at what our priority testings first. And of course, we did more of the seriously ill from the hospitals, and we're still doing that. We did mostly from the clinics, at what our testing inventory was, and we were very resourceful. We were very limited in our resources, and so that's why we decided to do the most serious ones and the more critical ones and the much more impactful ones. And so now that we have the expanded testing, we're moving out into the community. And as you can see, we started up north, and we were allowing people to come. We then went to the central, then we went to the south, and we did that because we wanted to have an idea of what the community spread is. We're now going into clusters of living, and we've done the Himilani apartments. We're going to be doing the the barracks where the workers live. We're going to be doing St. Dominic's. We're going to be doing senior citizen homes, the Guma Tranquilidad, and the other villages where the seniors. We're going to be doing over, I think, over 100, 200 seniors, and so that's what we are working towards. And of course, we are doing our first line responders, and once we have more tests coming in, we are looking at all those individuals that you were talking about.
And thank you.
Thank you, Wayne. Next is PNC, Kevin Kerrigan. Hi, Kevin. You can go ahead and unmute yourself. No, he's there. Kevin, Kevin, we'll go back to you, Kevin. Okay. We'll go back to Kevin. Patty Arroyo with K57, are you still there?
Yes, I am. Thank you. The Safe Haven program, according to the expenditures report, is allotted at $250,000, Governor, or Lester. What is that going to be for, considering now that we have gone backwards on the choice of Paseo as a homeless shelter?
Thank you, Patty. I think the governor responded to that question. We're looking for a hardened facility, one that has that lends itself more to social distancing and some separation, as opposed to the openness that Paseo provided. So we're actively looking to see if we can find a facility that will be conducive to providing this safe haven.
Sorry, I did hear that response. Can I do a do-over?
Sure.
Okay. So the question then would be, is the homeless population, in light of the fact that the homeless population is the least of the worries of positive COVIDs, a huge priority for $250,000?
The least priority? I'm not understanding your question.
Well, they're not a highly susceptible or suspected case demographic.
So, Patty, we are concerned about the homeless because we have had 2 positives. And the thing is, after you isolate them, where do they go to? And the concern there is they also are traveling all over, and they don't have the, I see them because when I go for a walk at Paseo, they don't have masks, and they sleep in a group and so forth. So we are concerned about them being possibly a very high risk in terms of transmission of the virus.
Okay, thank you for that. Governor, another just unrelated to the conversation about COVID, why did Pilar Laguana leave GBV?
I'm really sad that she decided to retire. She's retiring, and I don't know whether it's the COVID situation. With this, what people have done is they've reflected, and they've looked at, hey, there's more to life than just working. And so, but I don't know if that's the case. She just felt she has given 41 good years to GVB. and it's time for her to do other stuff, and she'd like to move on and do other stuff, spend more time with her daughter. She was talking about, you know, how her daughter's wedding had to be canceled. And so I think I'm thinking this is not what she said, but I'm thinking she had inner reflection on what she wanted to do. You know, she told me her age and I didn't believe it, but she said, oh, she wants to be able to live the rest of her life in probably a less stressful situation. And I totally respect that. I told her that I wouldn't get in her way, and but I'm very sad that she's leaving because she has contributed even just in the last year. She's brought in the numbers. She's very well respected in the international arena. I've been with her in Japan and South Korea, and people respect her. People look up to Pilar. And when she's making a presentation or she's conducting a meeting, they hold her opinion with very high regard. So we are going to be losing someone very good in the GVB industry.
Can I just ask one last question before I go to sleep? I just want to find it's been a long day, ma'am. I just
Me
want to know,
too.
I know, I hear you. Lester, who reviews these expenses? I have noticed, and I'm going to kind of call you out because I know you can handle it. You know, an $895 laptop bag seems to be an extravagant expense under your spending plan. Can you just address that, please?
The amount and the purpose is reflected in the agency submission. So when we get down to the actual expenditure and we deem that the expenditure would be better served in providing another laptop as opposed to a cover, you know, then we'll certainly do that. But in the interest of transparency, when we could have hid the comment section, we could have just given you guys the numbers, but that wouldn't be consistent with the governor's promise of being transparent. So what you see is what we got. And but will I approve of a $895 laptop bag? Of course I won't. But
Well, it was from your department, Lester. It came from BBMR.
but there was probably like a, let's put it
Sorry,
this way.
Lester, it came from BBMR. I'm just
Yeah,
that was the yeah.
But what am I going to use the $895 for a bag or several bags for this teleworking initiative that is throughout the entirety of this? The answer is no.
Thank you, Patty. KUAM, Nestor Lecanto.
Yes, thank you. So I want to go back to the reopening on May 11th of non-essential businesses. Will this include the government of Guam, and how much of the government percentage-wise will be reopened?
Yes, it would include the government, and we're looking at those services that are services that help support the businesses, like, for example, Department of Revenue and Tax, DPW, DOL, DOA. And we're not really having everybody come back at once. We're gradually going to be allowing them back. But also we are going to be reconfiguring our office space. And we've also are going to be, if it's a customer facing kind of service, probably put in barriers there. And of course, we would require mask and social distancing among the workers.
And have you already identified and advised the employees when they're supposed to come back to work?
No, we haven't yet.
Okay, but it would be May 11th, simultaneous
Yes.
with the reopening?
Yes. Yes.
Okay.
Thank you, Nestor. Guam Daily Post, John O'Connor.
Yes, thank you. I just want to follow up again on the safe haven program. Governor, I believe Senator Moylan sent you a letter on, I think, Saturday. Have you responded, or do you have a response to that letter? And do you know why it took until Friday night to make the decision that Paseo was not suitable for the program?
I have not seen his letter. It was up till Friday night because people were still saying that they were able to meet the Saturday deadline. But when I saw, based on press reports, that that wasn't going to happen, that's why I decided to delay its opening.
That decision came from you not to use the Paseo Stadium?
The
Is that from you
decision
or Public Health?
did come to me. I made the decision. I told them we weren't going to open because, again, the place wasn't ready, and that's why we didn't open right there at the Paseo.
Okay. I do want to go back to one of the earlier questions during the first round. I know, Governor, you stated to KOM's question something to the effect of that you've acted within the law when it came to the procurement of the quarantine facilities. And you've also were going through FEMA with all that. But when it came to this procurement, when it came to your legal counsel, Mr. Hai, procuring the quarantine facilities, and when it came to the advance payment of these facilities, some of whom have been paid, did that occur with the concurrence of the AG?
That
Was the
occurred.
AG? Sorry, please go on.
I don't know if it came with the concurrence of the AG, but we did act within the guidelines of the law as declared with the Public Health Emergency Act.
So do you know how the payments can be validated if the contracts and agreements with those companies have still not been signed off on by the AG? They haven't been finalized yet.
The payments were verbally agreed upon. It was $100 per room, which included food, 3 meals a day, included linen services. I thought that was a pretty good deal for $100 a day. And we wanted to quickly secure the place because we needed to house the people that needed to be quarantined. I wanted to make sure that our people were protected against these people who have traveled in hotspot areas. The time Philippines was really increasing in their COVID cases. Additionally, Japan was also again increasing. It was getting reinfected. So my main purpose and focus was to make sure we had these facilities, to make sure that we protected our community, to make sure that we wouldn't have a great increase of community spread. And so using my public health emergency authority, we acted within the legal confines of securing this piece of property for our COVID quarantine.
Thank you. And real quick before I move on, your signature is on the letters to the quarantine facilities along with Linda's. But were you involved in selecting the quarantine facilities?
I was not involved, if you mean that I'd go out there and look at them. No, I had people that could do that. They went out and selected. And I'll tell you how it was selected, and I'll repeat it again. When we needed this piece of property so that, again, we can protect our community, my legal counsel went out and worked with Mary Rhodes from the Guam Hotel Restaurant Association. And Mary knew what our budget was. And so she put out a call through her network of people, and only 3 responded. And the 3 that responded, when I got the numbers and the volume of rooms, and when we looked at the potential numbers of people that we needed to quarantine, it met our needs. And we didn't have the luxury, John, of going around and looking for places because we needed to secure the property immediately. And that's how it was selected.
Governor, in the end, there were 4 hotels. Is that
There
true?
were 3 first, and then we needed more volume, we needed more place, and then the 4th one came out.
Okay, thank you.
Thank you, John. Marvick has asked to skip her for the next round, for this round. So we'll go back to Adriana from I-94. Oh, Kevin has also, yeah, skipped this round as well. So we'll go back to Adriana, I-94.
Hi. So yeah, before I get to my my questions, real fast, if we could just clarify, who is acting GVB CEO then?
There is no acting right now because Pilar is still there.
Oh, is there someone being eyed then, or
I am going to be discussing that with the chair of the board.
Okay. Okay, so then for my my first question, how much are we budgeting for the independent third party to review federal spending? And will this be put out to bid or procured otherwise, even by your legal counsel?
So we are in discussions of procuring. We haven't really talked about the budget because what we needed to do is do an RFP and put out the scope of work that we want, and then the proposals will come in.
Okay, and then within your expenditure plan, it calls for $7 million to be paid to American Medical. Hello? Sorry. So it calls for $7 million to be paid to American Medical Center, FHP, SDA. So how much is being paid to each of the facilities, and was there an MOU ever finalized?
There hasn't been any numbers that have been decided. We estimated this, and so we put it in there as a budget. As you know, budgets are a budget. It's a plan. So we don't know exactly if it would be 7 million, but I wanted to put enough there to make sure that we can provide the financing. And just to let you know that the CARES Act does include medical expenses related to medical services by public facilities, hospitals, clinics, and other similar facilities. So as far as the memorandum of agreement, that is being worked on. So we don't have one signed yet. We are still in discussion.
If I could real fast, can you say why the $7 million payment is, and I know you said it's not finalized, but why is it more than the expenses for Guam Behavioral and Wellness Center, GPD, GFD, GMH? They're combined as 5.8 million.
Right. So this is giving it to a medical clinic, and this is for services and expenses that they have incurred or will incur as a result of being part of the CURES healthcare delivery system that we have. They are the first line of I guess first line of defense. They are the ones that are going to be triaging. They have already triaged, and they're the ones that are testing. They're the ones that are providing the specimens and so forth. So the services that they have and their professional services that they have, I certainly do believe it could come up to 7 million.
Okay, thank you.
Thank you, Adriana. Oh, go ahead.
May I add that the CARES Act funding, if you have a personnel costs in GPD, DOC, you can't supplant that with the coronavirus relief fund money. So to the governor's point, we needed these facilities. They're providing great support for the overall effort to address the COVID pandemic. But the analogy of taking, well, that's more money than the other people get? Well, it's because this funding is supposed to be in addition to and not supplanting, and it's unbudgeted, and it says it's specifically due to the public health emergency. So it's like apples and oranges to say, you know, somebody's getting this and somebody's getting more.
Thank you, Lester. Next is the point, Nick Delgado.
Half a day again. So in the $117 million spending plan, 299,000 was set aside for the purchase of 10 vehicles. 5,000 was set aside for Guahan Sustainable to help farmers, but there isn't much for setting aside for food or food banks for those in the middle class who are not qualified for programs like SNAP. What's your comment on those who believe you are leaving the middle class behind?
I don't believe we're leaving the middle class behind. We're putting about $40 million in to help those middle class. We don't really have food banks at the moment. If there is food banks, the monies would be directed there, but I don't think we have food banks. I know they have the SNAP program. Do we have food banks? I don't think so. So there is a program that we're looking at, Nick, with the farmers, and we are looking at, there's a proposal that we are looking at, which we would buy the products from the farmers and then give them out to our people. But that's a proposal that hasn't yet been put into place.
And maybe I can add to that the Guam Department of Education Grab and Go program, I think, is also funded in the budget, right? So that's going to be extended. Like currently, the DOE Grab and Go is until the end of what would have been the calendar year or the academic year, was mostly funded by USDA or federal funds. And so I think there's some funds in there to extend that into the summer. And so I think that also addresses some food security issues. I know that there's been already discussions as it relates to funding, and it's not a large amount, but out of GITA, we had requested the $10,000 for Guahan Sustainable toward those similar goals. So I know, unless you might have something else to add.
Governor, you want to also announce your Guam Green Growth Initiative?
We also have the Guam Green Growth Initiative that we are working very closely with the University of Guam, and that includes plans and programs for food sustainability and food security.
Okay, thank you. So what is the administration, on that note, what is the administration doing to expedite the applications for SNAP for those who are furloughed? I know some people who submitted applications since mid-April, they still haven't been given a status update on their application.
Okay, so I'm not aware of that. Nick, I do know that in discussions with Task Archangel, that there may have been people that applied for it but didn't meet the criteria of the SNAP program. But we're not using all of the criteria of the SNAP program. We're not looking into assets and all those kinds of criteria that is with the SNAP program. I do know, and I have seen it, where she told us it takes anywhere from 24 to 48 hours to process the application and to make a decision. So I'm not familiar with since April. If you know the person, maybe you can let us know and we can investigate it. So if you have the person's name, you can give it to Janella and we'll call the person up. Because they may qualify for our local program also.
Thank you, Nick. Next is PDN, Steve Limtiaco.
No questions. Thank you very much.
Thank you, Steve. Mariana's Business Journal, Wayne Chargaloff.
Hello, everyone. are there any updates on the status of the contact tracing app that was discussed earlier, as far as like when is it going to be unveiled and rolled out to the public?
So I do know that we've been working with the company, and I'm sorry I don't remember the company's name, but it's a Safe Path, Safe Place. And it is totally free. It is something that can be implemented and installed quickly. So you know what? I need to follow up where that is. Because of last week, I thought we were already getting into some kind of agreement with that application.
Okay.
So
and,
can we get back to you, Janella?
Oh, yeah.
Okay.
You can send, we'll follow up with you, Wayne.
Thank you. And the most recent round of testing focused on senior citizen centers. Will testing reopen for the general public again shortly?
Yes.
And when will that be? Is it reopened
We're
already?
gonna go in probably in another 2 weeks, maybe 3 weeks. We want to make sure we go around and try to get as many as we can through those identified populations that I just mentioned. But Linda and I were talking about it, and I did ask her that we need to come back again. And actually, the mayor of Agate also asked us to come back because the day that we were testing, it had rained, and he felt that not very many people came out, although there was like over 160 people that were tested. Yeah, they can also go to clinics, and we're also encouraging that. They can go to Northern Public Health Center, they can go to the Southern Public Health Center and the Central Public Health Center. And the Central one does a drive-through, so they don't have to get out.
Okay, thank you very much.
Thank you, Wayne. Patty Arroyo, are you there?
I am. Thank you. I am. Are you there?
Yes,
Okay.
go ahead.
All right. Gosh, I had another question and I just lost it. I apologize. That's what happens when you're staying up way too long.
That's because I made you
okay.
laugh.
Well, you did. You're very funny in that way. Again, about the following up on the question from the other reporter about the Safe Haven program, Governor, since we are not using the Paseo and you're trying to identify another place, then is there some kind of communication with any entities that might provide insight as to whether or not this, again, whether or not this is a viable cluster of people that is of great concern for the spread, since there are, like you said, have only been 2 positives? And do we expend that kind of money because of what the data and the truths are showing?
So we are communicating with, of course, public health. We are communicating with the coalition, the Homeless Coalition. And how I'm seeing this, Patty, is that if we do identify a site, I would like it to be a much more permanent situation. Either we lease the place for
You okay? Okay.
Well, there were no.
Okay.
It's a side joke, inside joke. But anyway, so we once we identify the place and it's a hardened place, we look to it also as a more permanent situation for our homeless.
Oh, but this is not the funding that's going to be this $250,000 in your is not going.
This 250,000 is just for the period of the COVID crisis. We have other funding sources that we can use for looking for a much more permanent situation.
I just a listener just sent me a note and she said she didn't think that it was appropriate to ask you, and I'm going to read it directly. Can you ask the governor if the items that were prohibited from being sold, including vapes, however, it lists permitted businesses to sell cigarettes. It sounds kind of a pick and choose for only favored business establishments. I don't know about that part, but if whether or not vape shops will be able to sell vape products. Right.
Okay, so there,
Yeah.
so there's a very, actually, they consider this also a public health issue with the vaping. There is there's a lot of literature that talks about the dangers of the vaping. And so there are organizations, Patty, of course, the American Cancer Society, Public Health, the Tobacco Coalition, people that are very concerned about the health effects of the vaping. And I think there is a law that already regulates it. I'm not too sure. I need to look at that.
Thank you, Governor.
Thanks, Patty. And I believe KOAM has also asked to skip this round. So we're going to go to Guam Daily Post, John O'Connor.
Yes, thank you. So, looking at the spending plan, it appears there are 3.5 million for credit card fees. I think this refers back to the team program that was made back in March. Why is it anticipated to have that much in fees, and how much is actually being collected by revenue tax during this closure?
Yeah, thank you for that question, John. One of the things that we did, the customer was paying the convenience fee. We made a conscious effort to, because of social distancing, to take on that financial responsibility. So if you're going to any Treasurer of Guam office and you have a government bill to pay, other than the utilities who didn't have the convenience fee placed on the customer, you would have been paying, I don't know, $104 for a $100 liability to the government of Guam. We wanted to do two things. Number one, minimize personal interaction. And number two, facilitate the ability to do these things online. It actually works better for the government of Guam to immediately get very secure sources of payment quickly. And it also is a convenience for the residents because you don't have to get in a car during a kind of stay-at-home period to go pay your bills. So the estimated cost for the government to absorb the convenience fee is $3.5 million.
I see. Okay. Governor, can you clarify the status of the FPUC agreement, the Federal Pandemic Unemployment Assistance Agreement? Did U.S. Labor release and sign the FPUC agreement with Guam Labor? And if yes, when does Guam expect U.S. Labor to send the funding? And did U.S. Labor approve Guam's proposed $924 million budget for the unemployment benefits program?
So the FPUC, it's an addendum actually to the agreement. And I know that Dave Del Sola just received it this morning. So he actually sent it to me right before I came here. So he sent it to my office. So I'll be looking at that with him. Once we are okay to the addendum, we would sign it and send it off. The 924 million, yes. I'm getting it mixed up with the 945 and the 924. Anyway, it's a 924 million expected expenditure that hasn't come to us. I think once the agreements are signed and once the implementation plan that Dave also just submitted, I think yesterday, then we could probably move faster. And of course, while doing all of that, we're training our people, we're preparing all our technology to make sure that we can do this online because it's a matter of monitoring this program every week. It has to be recertified. People who are receiving the benefits have to have it recertified every week. And also employers have to submit reports to Department of Labor, such as who did they hire, and we have to reconcile it with our records. So there's a lot of going back and forth in terms of accounting and in terms of reconciliation.
Just to clarify that last bit, I wasn't clear. Did U.S. Labor approve the 924 million?
Not yet. That's
Not yet.
just
Okay.
an estimate.
Okay. Thank you, Governor.
That's our estimate based on the number of unemployed that we are estimating to be.
Okay,
Thank you, Governor.
thank you, John. Okay, and I-94 is also left or has skipped. Marvick says she has just one question. Go ahead, Marvick.
Just one, oh, can you hear me?
Yes, go ahead.
Does the spending plan require legislative approval, or is it open for amendment?
This coronavirus fund is a fund that's given to either the CEOs of the states, and that's usually the governor, or it could also be the representative, official representative of the states. And so in our case, it's giving directly to Guam, and no, it does not need legislative approval.
Okay, thank you.
Thanks, Marvick. The point, Nick Delgado. Okay, Nick.
All right, thank you so much. And so with the announcement of the budgeted $7 million for those 3 clinics that's help in response to the pandemic, do you guys have an estimate of how much is set aside for GRMC, the non-COVID facility? How much is that?
We don't have any set aside for GRMC. GRMC is considered a hospital, and under the Cures Act, we actually were able to work back and forth with GRMC. That is one of the reasons we decided to go into the structure, so we can move resources back between the 2 hospitals. So there is no set aside for GRMC.
Can you say how much they will be paid? Sorry about that. They're being paid. The government's paid them.
Paid to GRMC.
Okay.
Thank
And
you,
so in
Nick.
the spending plan, it includes 3.5 million for credit card fees. So why does the team anticipate this much in fees, and how much has actually been collected by Reventex during this closure?
The question was asked earlier, and again, the amount is, the burden has shifted from the consumer to the government because of the social distancing, the stay-at-home requirement, and the desire that when we come out of this situation, we will have a different mindset, sanitation, masks, social distancing, and more of a reliance on telework and paying your bills online. So, I mean, your credit card authorization, it's not like a check. It's not going to bounce. If your credit card comes through and it's approved, it's approved. So it's a secure and quick way of payment, but it also helped in this period of time when we wanted people to stay home. So Reventex is not collecting anything. We are just shifting the burden.
Thank you. Thank you, Nick. Okay, so Steve is out. All we have left is Mariana's Business Journal and John from Guam Daily Post. So Mariana's Business Journal, Wayne Trugloff.
Oh, actually, I have no further questions. Thank you very much.
Thank you. And all that we have left now is John.
All right, Governor. So this is another question regarding the spending plan. I know we have been talking about the various aspects of it, but there's 20 million in software for DOA and Revenue Tax to comply with the CARES Act reporting. What software program was this, and why is it such a significant expense? In addition to that, how was the software procured, and how long is the contract for, if any contract?
John, you're talking about the expenditures overall for the Department of Administration's ability to ramp up in light of this paradigm shift and being able to process things with less customer interaction and facilitation of the multitude of tasks the Department of Administration has to address HR, payroll, and procurement. So we have long sought for a new FMIS system. We've been looking to try to find a way to modernize our IT infrastructure. So the governor gave us the green light to set aside funding both at the Department of Revenue and Taxation and the Department of Administration to achieve this goal. We are in the dark ages when it comes to IT. We'd love to be able to try to be more customer service friendly, more organized, more efficient. So we believe that this allows for technological improvements to include the ability to telework, which is one of the primary eligible expenditures allowed under this funding source.
Thank you, Lester. These next few questions involve, I suppose it involves the recovery aspect. I know we probably won't be taking in tourists until peak Q3, but is there any consideration on lifting the 14-day quarantine requirement for travelers from South Korea, considering they do have extensive testing being conducted there? And other countries have opted to lift bans from them as well in order to help reopen our tourist market.
There's always a consideration about lifting. I mean, we're considering all the restrictions that we have put into place to lift them so we can try to get back into normal life as much as what we may have to redefine normalcy after this pandemic. And so there is always consideration. My concern would be, and also from the physicians group and also from the business community, is how can we lift the quarantine of incoming passengers and still feel that our community is still protected against this virus? That's the biggest challenge. And that's the same kind of question that the business community are very concerned about. And I just want to say that, you know, the business community is working very closely with the medical community so that we can strike a balance, and so that when we do open and lift the restrictions on quarantine, that we are assured that we are decreasing, and our exposure to the coronavirus is going to be very, very minimal, and the risk is going to be very minimal. So the business community, John, is also just as concerned about it as I am. And as governor, I need to make sure that the balance is there, because my responsibility to provide safety and protect our people is very heavy and very serious. And I want to make sure we do things correctly the first time.
Thank you, Governor. Is there any consideration to supporting local hotels other than those being used as quarantine facilities and isolation sites? Presumably, these hotels are also experiencing some cash flow issues with no tourists, and presumably no tourists are expected to come anytime soon.
I think the support there for the hotels, John, is through the PPP program, and of course, we have our SB, the business economic expenditure in our budget plan here th- that something may be done with that. But I think the major support would be the PPP loan program.
Thank you, Governor. And so I do have one more question, and I believe this question was asked last week. And this is also in light of all the other questions today regarding the procurement of the quarantine facilities, as well as the oversight hearing scheduled for the procurement. So we do know that one of the hotels, Packstar, took out a mortgage with the Bank of Guam. So what do you say to any concerns or criticisms that there's some sort of favoritism going on with the selection of these quarantine facilities and the payments that are being made to them? Do you have any comment regarding that?
I say that it's absolutely untrue. My interest in getting the Pacific Star is absolutely not in any kind of consideration about mortgage. I don't think that's something that should even be brought out because there is no truth to that. My biggest concern was having the option and having the capacity to quarantine these people who are coming in from hotspot. The time that we got the Pacific Star facility, by the way, Mary Rhodes also put out a email when we were trying to get the fourth one, and they were the ones to respond. And so as a result of that, we were able then to provide the capacity to quarantine these people. And at that time, the United States was really increasing. They were having hundreds of thousands of new cases weekly. They were having thousands of people dying weekly. There was a hotspot in New York. Hawaii actually followed our lead in these quarantine. So as you can see, again, we are the leaders in this whole measure of containing coronavirus. So John, I just want to assure you that my interest is not because it has a mortgage with Bank of Guam. My interest is the people of Guam. My interest is protecting the people of Guam. And as governor, if I did not meet up to my responsibility, then it's not the trust that the people of Guam have given me when they elected is not being carried out. So any kind of notion about that is totally untrue.
So the response to any kind of implications of favoritism or illegalities is that's not true.
It's totally unfounded. Many were not interested in being a quarantine facility. The hotels were afraid that they were going to be branded as quarantine, and they were concerned about their ability to attract tourists and for tourists to come to their facilities. So, again, John, this pandemic situation is, like I said, a lot of uncertainties. It has impacted our economy in the worst way. I mean, even people are saying, even in World War II, this kind of crisis wasn't the kinds of deaths that we are seeing globally and nationally it's tragic. It's a tragedy. It's many lives are lost. Loved ones are lost. Fortunately, we only had a fatality of 5. But even that, I think, was too much for our people here. So again, my whole focus is very much towards protecting and very much of doing what the people of Guam have entrusted in me, and that is to protect their health and their safety.
Thank you, Governor.
Do we have, we only have 2 reporters left, Nick and John.
Yes, I just have one follow-up that just came in, if I can ask.
Okay,
real quickly. It's a response that Senator James Moylan just sent in a letter to that he titled, "Governor, we need to do more," saying, unfortunately, your plan is not sufficient. And so I just wanted to get your response to that. He notes the good parts of the plan and appreciates the $300 for individuals, that those that qualify, but his words, the plan is not sufficient.
I don't think any plan is totally sufficient in its own single way. There's a multitude of plans and programs that will make it sufficient. And for me, how we are sufficient in the well-being of our people is when we beat this coronavirus and we come back to normal life and we rebuild our economy and our people start really now behaving the way our culture behaves. I mean, just the fact that you can't hug your grandchild or I can't even go see my mother is just so disheartening. And I know everyone is faced with the same situation. So we need to get the plans, and not one single plan, like I said, is sufficient. There's a multitude of plans that we are using, and we are going to be initiating and implementing. And I think that's how we'll be able. So the goal is to really work it so we can get back to some normalcy and we can continue with the well-being of our people.
Governor Lester, Dr. Hernandez, thank you guys so much for your time and for the added time today.
Thanks, Nick. John, do you have one last question? Okay. Oh, wait, I'm sorry. Go ahead, John.
No, I don't. No, I don't. Thank you.
Thanks, John. Thank you, everybody. Thank you, Governor. Thank you,
Thank
Lester.
you.
Thank you, Ricky.